Indiana has increased efforts in recent years to make the overdose antidote Narcan available to more Hoosiers. But a new program from IU School of Public Health is taking matters into its own hands and educating Hoosiers on how to use Narcan and be a citizen responder. Mitch Legan has this report.
It's been 2 years since Amy Powell's youngest son died from an accidental opioid overdose.
We spent a lot of time out on these fields after school, watching all three boys play.
The thought of losing the youngest Powell was so painful to the family that they waited until recently to dedicate a bench in his memory at their favorite ballpark.
Cameron was a very normal kid in that he was definitely sneaking out of the house, going out with his friends, just having a good time. I never suspected any drug use from Cameron.
Cameron began feeling ill one day at school 2 years ago. He had taken an opioid earlier that morning, but that's not something you tell mom or the school nurse.
And was complaining of his stomach hurting. He was nauseated. When they went to wake him up, he was very hard to rouse. He was snoring.
Nobody realized he was showing signs of a near overdose. Later that night, Cameron took another and went to bed. It was laced with fentanyl, and he never woke up.
In retrospect, it was plain as day. I will say at least 3 instances where there could have been a complete stop and a check-in with Cameron to see how he was doing leading up to his death.
A new program from the IU School of Public Health wants to prevent stories like Cameron's.
I have 2 doses of Narcan because evidence-based practice is to provide 2 in every kit.
Chris Henderson runs IU's Opioid Rapid Response System, a virtual program that's educating Hoosiers about opioid overdoses and how to respond to them. Launched last September, the program trains people how to administer the opioid antidote Narcan and connects them with possible overdose events.
Firefighters, sheriff's departments, EMS are regularly, they're seeing these numbers increase in their community. They're saying to us, we need this type of intervention right now.
The OARS program, as Henderson likes to call it, builds off a program that started in Clark County. It's self-paced and takes about 30 minutes to complete. After someone's trained on how to identify and respond to an overdose, they sign up for an app that alerts them when one's nearby.
We only selected communities that had invested in a medical app called PulsePoint. We just happen to be leveraging technology that communities have opted to purchase so that we connect people in real time to possible overdose events and render aid.
Residents of Boone, Dearborn, Hancock, Monroe, and Madison counties are currently eligible for OARS training. After they complete the training, Henderson will send an overdose kit complete with Narcan.
After finishing your training and getting your Narcan, the PulsePoint app will connect you to possible overdose events nearby. The thought is, if you're available, you might be able to get there before emergency authorities and save a life.
I think it's incredible. I think it's crazy not to do it. There is such a need for educating our teachers, our families.
Emergency professionals agree. They do their best to promptly respond to calls, but it's tough to be everywhere at once, especially in rural areas. And when it comes to overdoses, minutes can be the difference between life and death.
Narcan is the only way to prevent somebody from ODing. And so whatever means get it to the scene, it will end up saving lives.
The United States experienced record overdose deaths last year. Indiana did too. An estimated 560 more Hoosiers died last year compared to 2019.
The pandemic really, because so many more overdose deaths have happened, it's really reinforced the need for this type of intervention to be available.
Henderson is working to expand the program to 10 more Indiana counties. They've been meeting with the State Office of Drug Prevention, Treatment, and Enforcement, and representatives from drug-free Marion County have reached out about a possible partnership. For Indiana News Desk, I'm Mitch Legan.
Those interested in signing up for the training can visit prevention.iu.edu for details.